Hi everyone, this is Dr. Vishnu Abhishek Raju. I'm a consultant in medical gastroenterology and hepatology. Today I thought I'll talk to you about hepatitis on the occasion of the World Hepatitis Day. Hepatitis is inflammation of the liver cell. Inflammation is swelling of any part of the body. In this case, inflammation is swelling of a liver cell in response to an injury or an infection. The usual causes are viral hepatitis, drugs, alcohol, toxins, and last but not the least, there is a set of disease called autoimmune liver disease. Now, when hepatitis presents, it can be either acute or chronic. It can come all of a sudden, or it could have been brewing over a period of weeks or months, and then it comes to manifest over a certain period of time. Now, let's talk about viral hepatitis. The most common cause of viral hepatitis is hepatitis A and hepatitis B. Hepatitis A presents all of a sudden. It is transmitted by fecal-oral route, most likely because of contaminated water or food. And hepatitis B can be chronic. It sits silently in the liver and blood over a period of years and manifests little later in adulthood. When it comes to hepatitis A, it presents like flu-like symptoms like tiredness, inability to eat, fever, abdominal pain, vomiting, yellowish discoloration of the eyes and urine, sometimes joint pain, sometimes itching. It's usually spread by contaminated water, contaminated food products. It presents acutely. It's quite common. The prevalence of hepatitis A is somewhere between 2 to 60% in India. When it comes to hepatitis B, it's a chronic viral infection transmitted from mother to child, or by unprotected sexual intercourse, or by transfusing contaminated blood products, including sharing of the needles during tattooing. When it's contacted in childhood, it tends to be a silent infection, sitting simply, and it manifests in adulthood. When an adult contacts a hepatitis B infection, it presents similar to a hepatitis A virus infection, like a flu-like illness and jaundice. Hepatitis C virus is something chronic that also can be transmitted from the child to mother, or by sexual intercourse, or by shared needles. It also presents as jaundice in the later part of adulthood. Of the viral hepatitis, the hepatitis B and C are very notorious because they can cause chronic liver disease like cirrhosis, and they can go on to cause liver cancers. Now, there is other cause of acute viral hepatitis, which is hepatitis E, which is relatively rare and more dangerous in pregnant women. Hepatitis D is usually a concomitant infection with hepatitis B. Of these, all the 5 viral hepatitis causes, hepatitis A and B have got vaccinations. So please be informed that vaccinations for these things are available. The best way to avoid hepatitis C is to avoid high-risk behavior. Talking about hepatitis B and C, how do we know that we have got this infection? In an adult, this infection may be silent. We may not know that we have got this infection. So we know this only by screening our blood for this kind of infection, either in a hospital basis or in a camp basis. Once we come to know, hepatologists will determine whether you need treatment for this virus or not. In case if it's very silent and inactive, you may not need treatment. Hepatitis A and E is usually self-resolving. We need only symptomatic treatment. Coming to the other causes of hepatitis, alcohol is one of the important causes of hepatitis. Not everyone gets it. Depending on your genetic pattern, depending on the type of drinking we do, depending on the nourishment status of the patient, certain individuals are prone to develop alcoholic hepatitis, which may be mild, moderate, or it can end up very severe. Alcoholic hepatitis can, if untreated, if unchecked, and if the alcohol abuse continues, can progress on to end-stage liver failure, needing liver transplantation. So the best way is to avoid alcohol. In case if avoidance is not possible, drinking responsibly is what is suggested. One other important cause of hepatitis is toxins and drugs. Unnecessary drugs, unnecessary exposure to toxin is to be avoided. So how do we avoid hepatitis? So a healthy lifestyle, eating high fiber diet, including fruits in our diet, avoiding saturated fat, and increasing the good fat like unsaturated fatty acids and monounsaturated fatty acids are one way to go about it. Avoiding alcohol as such is quite a good habit. Avoiding unnecessary drugs and exposure to toxins is what is needed. Avoiding excess fat in the liver is mandatory. People who are obese are more prone to develop hepatitis. So make sure that the weight is right. Make sure that we regularly exercise. That's one way of avoiding hepatitis. Non-alcoholic fatty liver disease is one of the important causes for hepatitis. Meet one of the hepatologists to get to know about the vaccination program for hepatitis A and B. Hepatitis C does not have a vaccine yet. So that's all about hepatitis. Thank you.